Thank you for joining us. I am Rena Large from the Early Childhood Funders Collaborative. We're so happy to have you with us today for this conversation on the why, how, and who behind building a strong network of state-focused Part C early intervention advocates. This year and last year have shown us that we have an urgent need for advocates at all levels to advocate for and protect funding and services for kids and families. And I'm really thankful today to have this space to learn more about the landscape of early intervention policy and advocates. We're joined today by our Start Early friends, Karen Berman and Judy Reed Parker. They're going to share a little bit about a landscape analysis and some other work that they are doing. And really happy to have with us Bridget Hurley from the Children's Agenda in Rochester, New York. She's going to share a little bit with us about being an early intervention advocate. And to get us started, I would like to invite Jerry Cobb, Executive Director of the Pritzker Children's Initiative, to share a little bit about why this work is important to Pritzker. This conversation, like many of the conversations that we host at ECFC, are inspired by member work and interests. And so thanks to Jerry for suggesting this topic, and I'll turn it over to Jerry to get us started.
And thank you, Rena, for making it happen as always. You're so amazing the way you keep all of these balls in the air and moving forward. Really great to be here, and thanks to all of you for joining this conversation. It's great to see the interest in this topic. At PCI, we've got a number of state coalitions that we partner with, and that I would regularly, they're working on early intervention as part of their prenatal to 3 policy agenda. And I would regularly connect them with each other across states if someone was working on something that I thought the other would be of interest in. And a lot of those connections ended up being made with Start Early, as this is work they've been doing in Illinois for years, and they most of the time have their finger on the pulse of what is happening in other states and nationally too. So I would bring them the information and they'd say, oh yeah, we know about that. It's really exciting. So they came to me and said they wanted to coordinate a cross-state effort for early intervention advocates to learn from each other and to strategize on both federal and state policy opportunities. And that really made sense to me that needed to happen. What I didn't fully understand at the time, though, was that this work wasn't occurring in every state, or at least not among traditional early childhood advocates that I would have assumed would have taken on this issue. So I went out to different states and asked who was leading on early intervention advocacy, because I wanted to make sure in supporting the Start Early folks that there was a good mix of geographic participation and participation across different political perspectives as well. So I went out to a lot of the different states that we were working in and asked, what are you doing in terms of early intervention advocacy, or is there somebody taking the lead on it that I should talk to? And I would get these blank looks. They had no idea. It just wasn't on their radar at all. And they didn't think that it was part of their priority list. And it was pretty stunning to me. It just seemed so obvious that, of course, this should be something that everybody should be thinking about. And so that experience just reinforced for me why it was important to really get a good understanding of the landscape of who is doing what around early intervention advocacy, and to figure out what we needed, where we needed to be filling in the gaps. And as part of that, to reach out to funding partners in different states to see if it was on their radar as well, and to lift this up in a bigger way. This seems to me an area of such important work, and yet we're finding through this work that Start Early's been doing that it's not always prioritized by advocates or funders. And so how do we change that? And how do we better connect and support this work across states? So I want to turn this over now to my partners at Start Early to share what they've learned, to talk about their approach going forward and bringing state advocates together, and to explore with all of you how we elevate this issue in a bigger way and find ways to raise it up in states where it's not currently being raised up as a priority. So I will turn it over to Karen and Judy at Start Early to take it away. Thanks.
So I think Karen is going to be sharing slides. Here we go. And for those of you that don't know, Start Early is an organization based in Illinois. We've been in the early childhood space in Illinois for over 40 years. I work on Karen and I are both on the national policy and consulting side of things. Karen leads the work in Illinois as well as nationally in this space. And I work in consulting and do this work in that space. So great to meet you all. We won't spend a lot of time on introductions because we'd rather dive into the work. So I'll let Karen take over the next slide.
Hi, everyone. Sorry, I was trying to get off of mute while advancing the slides. Judy, Bridget, and I want to acknowledge here. First of all, we're all so grateful to be here. It's such a great opportunity to talk to people about early intervention and the advocacy for the ecosystem that we have for this advocacy and really listen we're really hoping to dedicate a substantial amount of this meeting to being able to be in discussion and listening to what your questions are and what your thoughts are on how we can be doing better. So forgive us in advance that we're going to be a bit cursory in high levels so that, we know that we can always have future conversations. One of the things we think is really important before we jump into the work that, we've been doing with the states and what we're trying to build is to do just a little context setting. And I know that we're preaching to the choir here, but oftentimes when we talk about young children with disabilities and delays in the early childhood space, we find like it's really important to level set on why do we need to focus so much on this population, right? A lot of times we're talking about programs, we're talking about EI, or we're talking about childcare, we're talking about Head Start, but it's really important to remember that this is a population of human beings that often get prioritized in the early childhood system, but there's a broader context. Number one, for us, and I should say that by background, before working at Start Early, I practiced civil rights law and did work related to early intervention as the law was being passed and implemented. And early intervention and inclusion and lots of things for people with disabilities across the lifespan is a civil rights issue. People have fought for many years to have the laws on the books that we are talking about today in this meeting, right? This federal law, this system of services that needs to be available to all eligible infants and toddlers with disabilities and delays. And unfortunately, early childhood and the system of early childhood services is not different than many other systems that people with disabilities grapple with every day across their lifespans, right? Our systems, including the early childhood system, was built to exclude young children with disabilities and delays. And that's a sobering concept, but very important for us to tackle when we think about early intervention and how early intervention fits in to the broader early childhood system. Because basically we're having to dismantle systems in order to make sure that these laws can really actualize for the people that they're supposed to benefit. The other important thing for us to remember is that we're talking about a lot of children, and different research surfaces different things about prevalence. Certainly in the adults with disability space, it's 1 in 4 human beings, right? Oftentimes in the early childhood space, we're talking about 1 in 6. So even though a lot of times it's sobering and what Jerry shared is sobering, right? That we're not focusing on this issue. It's a lot of the children and families that we're trying to support in the early childhood system are children with disabilities and delays, or in the early intervention space, children who have substantial risk for developmental disabilities and delays that we can actually prevent by providing these services. And these laws are on the books because of the research that showed that these services work. Like early intervention is one of the most successful interventions we can provide to young children and their families. And it's important to remember that this is a intervention that's about the family. It's a coaching model for families. It strengthens family systems, and it's done in the context of families' everyday lives, whether that's at home or in their early childhood programs. So it works. It improves developmental outcomes. There's lots of research on that. It also has economic benefits. So no matter what angle you come from in the conversation, children are entitled to receive these services. It's one of the only populations in early childhood that has entitlements to services are young children with disabilities and delays. The research is behind it. It helps us economically. And as I alluded to in the beginning, what makes this complicated and more complicated than talking about Head Start or childcare is it's not a program. It's about a population of human beings that needs to be supported through this system of services across all of these programs. And so when we're thinking about all the things that need to change in order to be successful, we have to pay attention to all of those things. I think I'm passing it to you.
I think you are. At Start Early, we've launched a campaign to try to strengthen systems advocacy for young children. And here are our goals. I won't read them because I know y'all can read and you're getting the slides. But basically, one of the most significant things that we want to pay attention to is building state advocacy capacity through a shared learning, connection, and technical assistance. And as Jerry said, we had a theory about some things. We decided to do the landscaping to check it out. Can we do the next slide, Karen? So in support of the early intervention system advocacy, we're going to focus today on the landscape analysis that we did, but we also have an advocates collective, and it's a listserv for state advocates, providers, and family leaders with we're doing virtual meetings about key policy issues. We've got one scheduled in another week or so around workforce, because that has cropped up a lot as a lot of interest for our members. And we're also collecting and collating resources. And then we're going to have an in-person convening in the fall. And the collective is also supported by a number of national orgs who are focused on these issues. Our friends at Child Trends are members. We also have folks from 0 to 3 and a few other, the Georgetown Center on Children and Families. So they're all there also supporting state advocates and thinking about how to improve the system. And in the end, we really want to have an advocacy roadmap that's state focused, and it will be informed by these virtual meetings and these in-person convenings with policy solutions and advocacy resources that states have brought to bear over time. Next slide. So the landscape analysis. We did a review of federal and state policies related to early intervention, and then we honed in on 14 states with interviews with advocates, providers, and family leaders. And I want to give a shout out to Pennsylvania. I put it in the chat as well. They were just incredibly inspiring and really an amazing group of people to talk to when we had the interview, Lauren. And we had a theory. We had this theory that there was a lack of capacity in individual states to do early intervention and early childhood special ed systems change. And there was little to no representation in those traditional state and national early childhood coalitions. No strong cross-state network for advocates to work together and learn from each other, nor a coordinated national network of folks to do federal advocacy when needed. Next slide. We found out that was true, very true. And we also identified some system-wide challenges. Across the states, I think also the thing to think about is mental health. What Karen and I had a conversation about this morning is that it's underutilized, right? And we noticed there were a couple of questions in the registrations where people were curious about that, and we can talk about that more when we have the group discussion. But it is listed as a service that is a part of what children and families are entitled to, but it's incredibly underutilized. And I think across systems, everyone thinks it's a different sector is responsible, right? So like it sort of gets lost and hangs out there in a way that can be, that means that it never really gets addressed appropriately and systemically. Next slide. In talking with state advocates, checking in with our prenatal to 3 center and our friends at Georgetown, we've talked, and also with state advocates who've had success in addressing these issues. These are the policy levers that we've identified that we'll want to build out and talk more about as a collective over the course of time, right? And in particular, and no surprise, chronic underfunding. Lots of states don't often optimize Medicaid as much as they could for this particular system. Workforce recruitment and retention. I was in a meeting today in Oregon where they were talking about the challenge of the workforce and making sure that when there's a lot of energy, for example, in putting into improving and strengthening the childcare workforce, it doesn't then pit that sector against home visiting or early intervention or child health, right? Because there's a workforce crisis through the entire early childhood system. States can look at improving eligibility policies, broadening them in particular, and really thinking about outreach, specifically for infants and underserved communities. And then there's always that strengthening coordination side. All right, next slide. I'm trying to be quick so we have enough time to talk. And also Bridget has such great things to tell you about in New York. So these are the advocacy strategies that drive, Karen, it's you who are supposed to be talking, not me.
We're all good. We're all good. And again, apologies because I know that you guys can look at this slide deck later and look at sort of the crosswalk as well. We thought we want to make clear that when we're doing these interviews, looking at the research and how we're thinking about this collective, Judy has talked through a set of like substantive content issues that we need to pay attention to make sure that our EI systems are healthy and are actually serving all eligible children, right? And what are the best policy levers to make those improvements? We are also, and have asked in those interviews, a set of questions about how are you doing this advocacy? What ecosystem do you have to actually move forward these policy levers? And so what we've heard from people, and Jerry shared, like I have felt this pain as a state advocate in my own state of Illinois working on early intervention, is you do have to have people in your state who have capacity to understand the early intervention system, right? And do that advocacy. In the best of worlds, it wouldn't be just one person. But as Jerry shared, there are states out there right now who don't even have one person in their state who is able to dedicate their time to thinking about this issue and making sure it's part of their advocacy in their state for improving their early childhood system. We do need to succeed in any of the changes we're going to advocate for. And this is true, I know, for all of the early childhood advocacy we're doing. You have to have a cross-sector coalition of families, providers, advocates, and your administrators, which goes along with the importance of being able to elevate family and provider voices. I mean, you cannot get increases in funding in most of our states anymore for early childhood programs, including early intervention, if you can't elevate and center the voices of families and the providers who serve those families in those conversations. And it is a great need in many of our states. And we have to be able to focus not just on legislative. A lot of people will say, oh, I do state advocacy and we go down to our capital every year. And we do that in Illinois too. And it's very powerful and we need to do that. But a lot of the change happens with our administrative agencies, right? It's after the money's allocated, hopefully, or occasionally you might pass a new bill around these things, but a lot of it is in that program design. It's in how the services are being delivered, right, in your state. And so you have to have the capacity to be able to advocate at that level. And then the beautiful thing in early intervention in particular is because it is under a federal law, there's a fair amount of data that can be available at the federal level that you can use on your own state and do comparisons to other states. There's research. I'm going to suggest in this space, we need more research. We're always asked about return on investment, what the efficacy is of different things, and exciting news. There was just a research paper today that is published on the outcomes that children are getting from being in early intervention. So we're seeing some of this, but we don't have a lot of it. We need more of that in our states, and we have to be able to leverage that across our states, all of these things. And media. Media is a very powerful tool, right? It's very compelling when you listen to families talk about how early intervention changed their trajectory. It's also very powerful to hear about the families who talk about being on waiting lists for these services that they're not supposed to be on waiting lists for, and what it means for their child and their family when that happens. And again, these are things that we don't have to do state by state by state. We could get a lot more energy and efficacy if we were leveraging this information across our states, pooling our resources, which is what we're very excited to be doing through this new collective and Jerry's support in particular. So this is like sort of the final before I really do want to hand it to Bridget. So the key takeaways that we're finding from the landscape is outside of the individual substantive issues that we really need to dig into is, my gosh, we launched this collective and thought, to be honest, we'd have like maybe 30 people who say, I do state advocacy on EI, or I want to do state advocacy on EI. And within 48 hours, there were close to 400 people across 48 states and territories joining the collective. So we did take a deep breath, and it's why we're like really thinking about how we can do enough of this engagement with this collective. But my gosh, there are a lot of people, and the national partners in this space are fabulous and also looking to build expertise on this issue and be more efficient in how they're supporting states, right? You could support 5 states at once. So that's so exciting. As I said already, we need more capacity in our states, more staff time to actually do this work and to benefit from all the TA and support that national organizations can provide. We need sustained support for that provider and family advocacy, for the systems change, but also for individual children. And we're really excited to be here, as you know, because we know that, and we have examples of, and many of you who are on this call, so that's why it's exciting to be here, of folks who in philanthropy know that this system of services is really important and have been supporting this work, both in supporting maybe national orgs to do things, supporting communities of practice, supporting folks to maybe blog on these issues. But we think that we could be more strategic from a philanthropy standpoint too, in pooling efforts, in getting more out of those investments so that we can just be, frankly, more strategic all across the board in how we're building this system of advocacy for early intervention. I'm going to stop sharing, and then I want to introduce Bridget. So Bridget Hurley, boy, title, Chief Program Officer at the Children's Agenda in New York. But I have to say, like, as we said, like, we have to find our kindred spirits in this work. And Bridget has been one of mine. I admire and respect Bridget so much. The work that Bridget does and the Children's Agenda does for young children with disabilities and delays, both for early intervention, but also around inclusion issues, is astounding. And what they do with what they have has been incredibly impactful. And she's one of my go-to people when I'm looking for thought partnership on a strategy I'm considering or something I'm struggling with. And like, again, we're a small and mighty group. So what, Bridget, we've probably been on 3 or 4, like we go to the Division of Early Childhood Conference or the Build Conference or the 0 to 3 conference, and there's always 3 or 4 states that are on a panel talking about the work, and it's always Bridget Hurley. So I am always lucky to hear what she has to say, and I feel like all of you who may not know about the work that Bridget's leading are just going to be so impressed with what she's doing in this space. So I'm handing it to you.
Thank you so much, Karen. It's quite an introduction. I hope I don't disappoint. So really great to be here. I do want to shout out Start Early for working with us literally for years. We had a consultation grant with them several years ago where we really dug into both early intervention and inclusive childcare. So really got a big jump start from our involvement with Start Early. And yes, we've been at this for a long time. I am so excited to be part of the new collective. I said to Karen and Judy, I have found my people. And I'm thrilled at the possibilities that are in front of us because of this new collective. So I am just going to tell you a little bit about the organization that I work for. By the way, I also want to say I do not work alone. I have many, many people, including some folks on this call who have been part of this work for years. So I'm going to talk a little bit about the work we do in New York State, but then really want to pivot to parent leadership and parent advocacy, because that is really one of the very bright spots in our work in New York, and would love to see it happening in other places as well. As I know it is, but we need more and more and more. So I work for the Children's Agenda, which is a nonprofit child advocacy organization, and we're based in Rochester. We work on a multiple issue agenda regarding children across the state, as well as doing still some local work here in Rochester and Monroe County. About, it's almost 9 years ago now, I was attending our county legislature meetings here in upstate New York. I noticed that there were more and more families coming with young children, some of them in wheelchairs and some, on hips, and the parents were talking about how they couldn't get services for their children. That was the birth of what we now call our Kids Can't Wait campaign, where we realized that, yes, there was this entire population of children and families who were not getting the services that they needed and had a legal right to. We quickly found out that, at least in New York State, we were looking at state level issues. Our counties devote a small amount of dollars to early intervention or preschool special education. So actually, they wouldn't call it small, but in the scope of things, it was really a state issue. And so since then, we've built a campaign of a couple thousand folks that are on our mail list and participate in our action alerts and come on buses to Albany and call the governor literally 24 hours a day because there's a voicemail overnight. So these are young parents who are often awake at night, and I say, call her and leave a message. So in New York, up until a couple years ago, we were the 50th state in the nation when it comes to rankings on timeliness of early intervention service delivery. If you counted the territories, we were 56th. So nothing to be proud about. We have now elevated to 48th, but that's only because Nevada and Delaware got worse. We also got worse when it comes to timely delivery of EI services. So we have a system that's really in crisis. About half of kids who are eligible for EI don't receive services or receive them delayed in a delayed manner. We have inequities that have been documented by the state itself, as well as federal OSEP reports and a New York State Comptroller's report. So I don't need to tell you, although we can talk about it later if you'd like, there are lots of numbers indicating that we have problems here in New York State. But let's talk about the families. We have been able to put together a parent group, which here most from Rochester, called the VIPs, which is very invested parents. They chose that name. That has grown now to be a group of statewide advocates. And I will give a shout out to Robin Hood, who I know is in the room. We were able to get funding last year from the Robin Hood Foundation to offer subgrants. So now we are seeding parent groups in other areas of New York State. Which is really important because at this point, I think the legislators and the governor's office is very used to hearing from Albany and Rochester on these issues, and they need to hear from a much broader spectrum. I was asked to talk about what I feel are the important pieces of our work with parents that really has, engaged them in a very deep way. And so I'm going to try to do that, but as you all know, it's a complex process. It's not just volunteers. You're asking volunteers who are struggling with issues in their own families, and who are, the closer you get to the early intervention age, the more, I think, exhausted, right, the families are. And so we need to keep all of those things in mind. I think the most important thing in terms of our work with parents is, of course, the relationship. We have an amazing parent leadership manager at the Children's Agenda, Carmen Torres, and a community and parent advocacy coordinator, Isabella Rosa. And they're just amazing people who immediately engage with parents. So, of course, that's an important key, is to have someone to do the outreach that really cares and can really relate and really highly values relationships. Also, they need to keep really good notes. They need to keep really good contact notebooks and spreadsheets. And so it's sort of a dual skill position. And we have two really terrific people. We prioritize leadership development over advocacy 101. So we are training on things like facilitating meetings, and we're training on things like taking meeting notes, how to plan a meeting, putting together an agenda. So these are skills that the parents tell us they use in other areas of their life as well, but it's not just about how they can help us have the meeting with the legislator and tell their story. We offer stipends. That's really important. So they know that we value their work very much. We have MOUs with all of our active VIPs. There's about 70 right now. And again, those are the folks in Rochester. And then we have this network now that we're building around the state. The storytelling piece is critical. And it's important to handle that part of our parent leadership strategy in a very careful way, so that, of course, people don't feel exploited. Like, hi, nice to meet you. Can you tell me your story so I can share it with the legislator? No, we wait until we have a relationship with the parents and then do some training, very conscious of not wanting to re-traumatize a parent by asking them to tell their story over and over. It's totally fine, of course, if they're not comfortable. And if they are, we might videotape it so that we can use it in a lot of different contexts without them having to retell it. The media are very interested in hearing from the parents. We always have a parent speak actually on any of our issues when we're doing a press conference. And it's always, there's always a line for reporters to speak with the parents. So that's really important to get them ready for that onslaught of questions. So a lot of work around media and communications. And I guess I would say, I guess just two other things. One is we really encourage them to take external trainings. Go join another parent group. Go to a Kofi training. Go to a Midwest Academy. Go get training, and then they always end up bringing it back to us, which is really helpful. And they love the connections. And then last thing I would just say, very regular meetings so that they know. We have parents who are at 3 or 4 meetings a month for their children's agenda because we have a couple of different subgroups. And it's just become a family. They've gotten quite close. So they're amazing, amazing people and amazing advocates that literally, like the governor has mentioned, are parents to us. So they're really getting the attention that this issue needs. And I'm open to questions.
Thank you so much, Bridget, for sharing some of those experiences and the elements of the work that you're doing with parents. And thank you to Karen and Judy and Jerry for getting us started early. I'm gonna just open up to questions now. If there are questions for our speakers, I'm also curious if others in the room are doing work around early intervention. I know that there's some other folks from New York who are part of the network that Bridget is talking about. You are welcome to share a little bit if you would like about what this looks like from the funder side. So go ahead, everyone can take themselves off mute, and you can come on camera if you would like to be. So I'll just open it up to questions. You can also type them in chat.
It would be also great if people are doing particular work in their own states or nationally to share that as well. Just more information for us all to have.
Rachel, I'm sorry. I did not see your hand up. Please jump in.
Thanks, Rena. Good afternoon, all. I'm Rachel Bonsignor. I have the honor of leading Liftoff Western New York. We're a regional early childhood funders collaborative that stems from the Pennsylvania border along Lake Erie and Lake Ontario, includes Buffalo and Niagara Falls, and we're geographically about the size of Connecticut and have about 100,000 young children under the age of 5 within our region. And I just wanted to give an incredible high five to Bridget and the Children's Agenda and the Kids Can't Wait campaign and coalition. We have been a part of that. To Karen's point of meeting our people, when Bridget asks me to do something, I say yes. And so when Bridget approached Liftoff Western New York with this opportunity, it was really kind of a serendipitous moment in many ways, because many of our members, we have about 30 funders around Liftoff's table. And several of our members were concerned, not so much in the ways in which Liftoff was leading around early school success and early childhood priorities, but really wanting to make sure that we were prioritizing and including children with delays and disabilities, that there were several of our members who really had in their grant making priorities around children with special needs. And they said for them to really show up and be at the table, that we wanted to include all children, not just some children. And so when the Kids Can't Wait opportunity came to join the table and campaign, it was a really wonderful moment in so much that we could not only organize and uplift the needs that are happening at the ground level within Western New York, but also for our grant makers who said, we know our grant making for a particular individual organization or agency is incredibly impactful, we really know how much of an importance it is to look at the systems level and the county and regional level and state level work. And so part of Liftoff's contributions to the coalition and campaign is organizing and uplifting Western New York and the greater Buffalo area as part of the campaign. And that looks different and depending on the time and the season. But also my time to be alongside Bridget. And I also want to give a shout out to Audia 2 from Robin Hood and my colleague Megan Batista, who's joining us today, for Megan and I to show up in these rooms and help to uplift and inform the message. So just wanted to say that's what it looks like a little bit from a regional ECFC perspective, but also most importantly, I just wanted to give a high five to my partner, Bridget, and all the work that she's been doing through the years with her colleagues and thousands of others across the state. It's really, we're doing some really great work and there's an incredible need. So thanks.
We could not do it without Liftoff, I'll say that. Absolutely.
Andra?
You were close. Andrew Wilkinson from Child Friends. The question that I have is some of the states that we work with as an evaluator, they have really willing partners at the state level. So I'm thinking Massachusetts, they got parent advocate groups, got the state to make a change a few years ago. They just went back and updated it. They made a change again in eligibility criteria for early intervention. Where I think they're having problems is that where the rubber meets the road in terms of the child find procedures, how the families are getting access to care, because the state is trying to take all the barriers out of the way, and still families aren't engaging with the services at the level or the timeliness that we know is really important. So I'm curious what advocacy looks like when it is at a regional level, or something in the system is not letting the system work efficiently. And so when it's murky, you don't have something to point at, where does the advocacy go then?
So I'm going to take a stab, and then I think Karen probably has some thoughts about this too from her Illinois experience. But and Bridget definitely add. I don't know that it's always murky, right? I think honestly, I think the workforce issue is a huge thing. We do not have enough early interventionists anywhere in any state. That is a huge problem. I think also care coordination is incredibly important. And I think that supporting, once you've gone through the child find, if you've identified the services, you've had the IFSP, there's still work to be done in helping families have a warm handoff from that IFSP experience to the service provider, right? And I think that there's a gap there for families, and a pretty big one as far as we were talking about the mental health issue, right? People not accessing that, not having that funded frequently. There's also a piece of social work, right? These families are there's a lot on their plate. There's so much happening for them. There's so much happening for all families, but add a young child with a disability where you're trying to make sure that their needs are met and trying to get all the service coordination, trying to transportation, all these things. They need some webbing, they need some scaffolding to help them get through that. And I don't think many states have the resources to make that happen. I don't know, Karen and Bridget, what you would.
Yeah, Andrew, I don't know if this is responsive. I want to make sure I understand your question before jumping in, to be honest. But it's like, if what you're saying is, which I think is true, is like sometimes we can get those changes made at the state level. We can say, okay, we're now going to serve all kids with substantiated cases of abuse and neglect, or even we're going to put more money into the system. But then somehow we still see these challenges when it gets down to the ground. And I do think like a lot of times my experience has been sometimes we're solving to the wrong problems. And you really do, to your point, you really have to work at the community. Some of these are clear state systemic problems and changes, and we can push those policy levers to get those changed, right? And some are like how that gets implemented on the ground. I'm going to give one example that I always go back to because I feel like this comes up a lot of times. People will say, oh, we're not serving enough children in early intervention. And the immediate assumption is we're not, and we're not. None of our states, although Massachusetts is one of the best, but none of our states are serving the full number of infants and toddlers who are eligible for this program. Not even close, right? And the immediate assumption is we must not be screening enough. We got to invest and fund more developmental screening. And I see a lot of folks working on developmental screening, coordinating across people who do developmental screening. We thought that in a community. We actually did dig in. This is an old example in Illinois where it was like we had fewer kids in one community being served in EI and others. The assumption was we're not doing developmental screenings. We funded a project we didn't, but like in the state, to do those developmental screenings. Sure enough, we did a lot of developmental screenings. We still didn't have kids in EI. Why? There was reluctance to have people coming into their homes. There was a mistrust of a system, right? That's one example. The other is a lot of people who refer children for early intervention don't actually understand the eligibility criteria. There's a reason why we are not serving babies under 1. Why don't we serve, and we never have, and we have not moved the needle on this in the country, serving babies under 1 in early intervention? Why is that? Those babies are not going to be eligible because you do a developmental screening. But if I'm a home visitor, I'm a Head Start provider, I know I'm supposed to do a developmental screening, and based on that screening, I now refer the child. You're going to miss all those children who actually don't have a delay or a concern on the developmental screening, but are automatically eligible for early intervention because they have a medical diagnosis or a condition where they're eligible, right? But we are missing across the country, the vast majority of those babies. And then people say, oh, those families are overwhelmed. But seriously, these are like conversations we've had where people will say the reason why we're not serving those families is they're just finding out that their baby has an issue. They've got all these other things they're dealing with. It's actually a myth. Like there has now been research done in like you're saying, in certain communities. In Illinois, there was a research project to connect families from the NICU to early intervention. Every one of those families in that research study wanted early intervention, and only 1 got connected, and 1 was found ineligible when they're automatically eligible. So we have a lot of work to do in our states to make sure that people truly understand who's eligible for early intervention and know how to make those referrals. But to your point, like probably if we were to show the process of getting EI at every one of those points of connection, I think you would find a thing where you have to dig in at the community level to solve that problem because the policy is okay. It's the implementation and the understanding of the individuals involved that's contributing to some of those lack of connections.
Thank you, Karen. Darcy, I think your hand was up first. Would you like to ask your question?
Yeah, thank you so much. Very interesting conversation, and I've been immersed in this field for a very long time. So I am both a funder and a developmental pediatrician. So I have a very unique perspective here on what's going on, and I've been involved in system development for a very long time. First of all, I just wanted to talk a little bit about the mental health issue. I think that at least way back, I'm from Connecticut. In the state of Connecticut, 20 years ago, they said, that's not our issue. We don't do mental health. That's not ours. Okay. However, now they're not saying that. But the truth is, we have very few providers who know how to serve very young children. If you really want to serve them well, we need to have dyadic intervention with the parent and the child together. We need people who are trained specifically to serve very young children who are often, it's not just, play therapy. It really is relationship. Many of these families also are multi-challenged. There are many issues that they have, and that is often a major contributor to the problems that the child is having in terms of their behavior, because these are parents who are incredibly stressed. We all know about toxic stress and ACEs, and this is exactly the population of children. If we could find them, which we actually can find them, but if we can provide them with appropriate services and supports, it would make a profound difference. Lots of times they present with language delay, because language obviously comes from the interaction between a caregiver and child, and it's through that interaction that language develops. But it's not often recognized that this is also a relationship-based problem, and we need people who are specially trained. I would also, so I think that's a big issue. I don't think it's not an access, that they're not accessing people out there. There are just not many people out there, and that is a system issue. That's a state level system, because in Connecticut, and I'm sure in many other states, there are many efforts to serve children, given we have a mental health crisis, but they are not really thinking about the kids under 5. And they're certainly not thinking about the kids under 3. The other issue, I think Judy mentioned, care coordination is absolutely essential. I mean, we think it's not an kind of like an optional service. Pediatricians are among the most trusted individuals in the lives of families, or they should be if there's continuity. But there's that other step. I mean, the parent is much more likely to go if the pediatrician says, this is, something that I recommend, and has a good connection with the family. And that relationship is critical. But you need a care coordinator to help make that connection. And that's another place people just fall through the cracks. So, I mean, I could go on and would be happy to, but those are just some thoughts. Thank you.
Well, thank you. And I think we have a comment. A hand that was up previously. Go ahead.
Yeah, I lowered it, but just my name's Audia. I'm with the Robin Hood Foundation and work closely with Bridget and Rachel and Megan on the Kids Can't Wait work, and love doing so. I won't repeat what other people have said, although agree with all of it. And Andres, sort of to your question, and Darcy, building off of what you were saying, especially from the pediatric view, in addition to working with CBOs and trusted messengers here in New York City, in terms of getting children not only referred, but then having that retention rate, converting that to an actual evaluation. We fund what's called the Fund for Public Health. It's like the nonprofit that you kind of funnel money through for the city. And they have created what they're calling electronic health records EI system. It is not glamorous, it is not sexy, but it works. And it is directly working with the 5 largest public hospital systems in New York City, and connecting with pediatricians so that they can, instead of handing a piece of paper to a family with an EI referral, it goes directly into a database, and there's this bi-directional data sharing that has resulted in 9,000 to 10,000 additional low-income children being referred and connected to EI annually. So I just bring that up to say there are relationship-rooted solutions, and there are some data automation things that can amplify those relationships as well.
Thank you. Okay, we have a few minutes left in our scheduled time. This has been a really interesting conversation, and thank you for all of the comments and the questions. Thinking about other places, other states where there's advocacy work going on, start early. And Bridget, if you also have thoughts, as we leave this conversation, what recommendations do you have for funders in other places to think about how they can connect to the advocates in their state, who is doing this work in their state? Tell us a little bit about what you would like to see.
I have had connections over the years through some other national collaboratives before this early childhood collective, early intervention collective came into place. Rhode Island has done some really amazing work with early intervention in terms of rate increases. They've definitely had some success there. Michigan is always interesting, both in terms of their structure and, kind of how they administer the program. And of course, some really fabulous advocates there as well. Well, let me just say, let me just say this since we don't have time. The Partnership for America's Children is a national association that the Children's Agenda belongs to, that is made up of organizations just like ours, nonprofit children's advocacy meaning systemic and policy advocacy. And that might be a great place to start if folks are looking for this work in other states, or just ask us. If I had, 10 minutes, I could give you another 10 names. But I will tell you, we are hungry for connection and for platforms to connect and to share. I got doing a report last fall, learned so much about how other states administer early intervention and connect with families and all kinds of other things. So it's ripe for the work that we're talking about.
Yeah.
Rena, I know there was a question too. I wanted to not ignore it because you had shared some of the questions about red states, blue states, purple states, and how to do this. And it really struck me. Every single state participates in early intervention, and currently, which is not the ideal thing, it's voluntary under the federal law. If you agree to do it, then it's an entitlement, but it's voluntary. And I think it is because of what we talked about in the beginning, that, you can't dispute the research on the intervention itself, right? Both from a development and an economic standpoint. And so we have to talk about the issues differently sometimes. And I will say, I was really pushing myself to say what's different. The Medicaid conversation and the ability to maximize Medicaid funding, that may look different in terms of advocacy. The ability to garner a lot of state general revenue, which is critical since the federal government does not live up to its promise of its investment in this program. That can be more challenging, although frankly, we're all challenged in our states on that, regardless of, what color the state is. But I think it's empowering to think about how every single state participates in this, follows, is it signing up to follow a federal law that provides an entitlement for children and families, and how many states were eager to be part of a collective around it. I didn't want to ignore that question. And it comes up a lot. You may have to talk about the issues different, and we have to be thinking about that strategically, right? It's often why you'll set up a subgroup for people who are in red states about well, I can't go to my capital and talk about equity. And it's that's okay, because there's lots of ways to do this advocacy that can be effective and do it within the context of your state. But the other thing that's pretty unique about early intervention in particular is that there's a lot of programs we have that are publicly funded that have eligibility criteria around socioeconomic lines, and that can be challenging. This one's not. So the buy-in and the ability to advocate both administratively and legislative in states on this issue, you have a wide range of people who benefit from this program across socioeconomic lines. And we often, I'm never in a room where someone doesn't say to me, oh, my kid got early intervention, or my grandchild got early intervention, or my neighbor, because it is such a program that spans that socioeconomic divide that really this should be an area where we can increase our capacity for this advocacy, be more strategic, and do better in it. There's a lot of buy-in, literally, for these services, and a lot of people benefiting from them.
We have we have a couple of things mentioned in the chat, and I will follow up with Karen and Judy and Bridget to make sure that we have some of these additional resources, and thinking a little bit about how to connect with efforts in your state. If you're not in New York, you know how to connect in New York now. Thank you so much for joining us. We will follow up with the recording from the session and some of the links in here. And if you have examples of your own that you would like to share that we didn't have time to talk about, or if you have some key resources that you would like to share with this group, let me know. We would love to include them in the follow-up. Thank you so much, everyone. Have a great day.
Thank you so much.